How often does squamous cell bladder cancer recur? Imagine facing a cancer that tends to come back even after treatment, often quite soon. That's the reality for many with squamous cell carcinoma of the bladder, a less common but aggressive form of bladder cancer. And like the more common urothelial carcinoma, squamous cell bladder cancer has a high chance of recurrence, especially in the area where it originally developed. Studies show that about 90% of deaths related to this cancer within 3 years are caused by the tumor returning locally, not spreading to distant parts of the body. This means the cancer often comes back in the bladder or nearby pelvic region after initial treatment. Recurrence usually happens fairly early, often within just a few months after surgery or other treatments. For example, in some cases, the cancer returns or spreads again around 6 months after bladder removal surgery. This quick return highlights the importance of close follow-up after treatment. When looking at how many patients stay free of cancer for 2 years, the numbers are quite low. Only about 1/3 of patients with pure squamous cell bladder cancer remains recurrence-free after 2 years. That means roughly 2 out of 3 people experience the cancer coming back within that time frame. The overall outlook for squamous cell bladder cancer tends to be less favorable than for other types. The 5-year survival rate can range from around 23 to 40%, depending on how advanced the cancer is and what treatments are used. The high chance of recurrence plays a big role in this outlook. Factors that influence the risk of the cancer returning include how deep the tumor has invaded the bladder wall, its size, whether it has spread to lymph nodes or other organs, and whether the entire tumor was successfully removed. Removing only part of the bladder, known as partial cystectomy, carries a higher risk of recurrence because some cancer cells might remain. In contrast, removing the entire bladder, called a radical cystectomy, can lower this risk but is a more extensive procedure. Compared to urothelial carcinoma, which can also recur but tends to do so over a longer period, squamous cell bladder cancer tends to come back more quickly and aggressively. Most recurrences are local, meaning they happen in the bladder or nearby tissues, and these local recurrences are often what lead to death from the disease. Because of this pattern, early diagnosis, aggressive treatment, and vigilant follow-up are essential to catch recurrences early and improve outcomes. If you or someone you know is dealing with this cancer, it's vital to work closely with healthcare professionals to develop a personalized plan for treatment and monitoring. Remember, every case is different, and ongoing research continues to improve our understanding of how best to manage and treat this challenging disease.